don't think there is any problem in either.
Now, having understood about this aspect, now I would like to have a discussion on how these globules or liquids or the diskettes can go into the hands of the consumer, that is the patient. So whether you are putting it in a bottle, is it good? Is it a glass bottle is good? Or a plastic container is good? Or putting it in packing it in a paper is good? Or putting it in a paper cover is good? Or taking a plastic sachet? So which are these methods where we can try to bring a better quality dispensing point over here? So I would like to ask Dr. Ramdas on this aspect.
Well, purity is the criteria, basically. Now, for example, if you think of plastic coils which are now abundantly used, I think there are standards of plastic also. Biograde. So, that is one criteria I think we need to keep. See, the point is anything that can pollute the medicine, any object that can pollute the medicine can reduce the effect of the medication that you are introducing. So hence, those substances that can reduce the effect must be avoided.
So these are the glass
Yes,
vials?
These are the standard silica glasses. Standard silica glasses. Silica is fundamental thing of the glass. So this can retain the purity of the medicine without spoiling it. This is the most ideal thing. If that can be done, that is number one.
But what about these amber colored bottles also?
Yeah, see, there are now if you expose it to sun's rays, that is a criteria.
With this?
No, with this and this one. Some people say that the UV rays are filtered through this, so the purity of the medicine is maintained if it is kept in an amber glass. Whereas this doesn't have that kind of provision.
Exactly.
Hence, best thing is avoid it from the sun's rays. Why do you want to expose it to sun's rays if you are using it in a white? That is why usually the teak wood chest that we used to get, which are the best set earlier we used to get. Even now it is I think available.
It is available. Yes, definitely.
But keep it in a cool and dry place, not a damp moist place. That is one advantage. And as far as dispensing when the paper is concerned, it has to be print free. That is number one. And number two, preferably if it is a butter paper, that is the most ideal. Or at least a plain paper, biodegradable paper would be the most ideal.
What about these plastic containers?
See,
nowadays many of the doctors have been dispensing through it.
See, one thing that you have to know, if you are dispensing in this, don't charge the medicine in this. Ideally speaking, only because again the alcohol can stimulate some reaction with the plastic, which may release its own, it can get polluted, contaminated. Whereas if you charge the medicine, dry the globules and then put it in this and dispense it, that's a different thing. I think purity can be maintained in that way for practical purposes. So this is a observation that has been made. Because plastic has its own medicinal property.
Exactly.
So if one goes into probably a materia medica of plastic, I don't know. Do you have any idea, sir? I don't have any idea. One may do the proving of plastic.
No, even today the scientists, they do conduct all kinds of tests in the glass containers only.
Labs, yes, purely.
So the glass is
most ideal
than the plastic containers.
Right.
Dr. Rudresh?
Ideal homeopathy, ideal prescribing, ideally doing things are on the other side. If a chance is given, we would all like to do this. But will we able to do this? Number one. Number two, I give in a bottle I give this, half of them come with a broken thing. I give it to them, they keep it in their pockets. Somebody in the bus, they push, somebody, whatever happens, this breaks and they come back, number one. As Dr. Saitley puts it, for every patient we may not have time to educate them, telling that keep it in a dry, cool area. They have kept it on when he kept it was dry, cool only. When the sun started coming down, the rays started falling, that which he is not aware. He has kept it and gone from the home. incidentally or accidentally, if it falls 1 hour the sunlight falls on this, then my thing goes. So it is always safer to biodegradable plastic. In the plastic also now, there are something like Tupperware people.
Yeah, these are non-reactive plastics.
Non-reactive plastics, which, but one good point with Dr. Ramdas was, you charge it in on a plastic vial, dry it
glass
up,
vial.
then transfer it to this vial dispensing. It's all true. That means we are all at one side, that all the doctors need to take care of prescribing and dispensing both.
Exactly.
We are not thinking in terms of giving a prescription, go it like anybody else, take it from the pharmacy. No. Let us come to that step by step. That means that indirectly all of us are accepting the norm that everyone are dispensing medicines in front of my own eyes, and every individual practitioner dispenses his own medicine. From this, now the further question starts probably, which he may come at the next slide, which I am more interested in that than every one of us are doing this. Every one of us doing dispensing medicine from our own dispensary. We don't trust the pharmacies. Why? Why? Universally, and literally lot of techies and lot of what so-called educated people, when they come, you just make us sit here for 1 hour to get the medicine. You just give a prescription. We just go and buy it over the. We have no time to sit here for 1 hour. To see you 1 hour, to take the medicine 1 more hour. Who has the time? Give a prescription. We go to the pharmacy and buy it and go away.
Exactly. We are going to have that panel of discussion.
Oh, probably. I mean, that would
whether
be
homeopathic medicines
no
should carry the
no,
name on the of the prescribed.
No, we are gradually hiding from the prescriptions and dispensing from the individual doctors to universal accepting pharmacies, universal accepting dispensers, universally accepted norms which has been prescribed by the, if possible, according to the European Council, European Commission, European Commission for Classical Homeopathy. They have their own prescribed very, very strict norms. Whether we have to follow that, or we should follow that along with some moderate changes to the Indian ethos. Because it may be very, very difficult to follow whatever they tell, dispensing, touching with hands, taking the medicines, procuring it. So the next step is whether, okay, you are all doing this, but while doing this, are you sure that whatever you are dispensing medicines will confirm with somebody that what medicines you have prescribed is the same medicine? Are there any methods to find out whether what I have got Natromur 1M from the company is the same medicine to give it to this man here? How do you go about? That's why I said my first few words were, it was my faith in homeopathy, it was my faith in the pharmacies, it was my faith in whatever the system which we are trying to follow. But this should not go on. If we call ourselves is a scientific system, we should evolve certain things. Today, I think if that happens, nothing like that. I mean, I would like to throw upon that. These things are fine, but what next?